So we're seeing a lot of cardiac cases. So I'm Dr. Jay Kovar with the Harris County ESD 11 EMS. We've got a question here about chest pain.
Hi, I'm Cynthia Williams, CTE Director for Spring Independent School District. Hi, Dr. K. What are some of the signs and symptoms that women should look for to make sure they're not having heart problems?
So it's a really good question. So what we're going to do is we're going to focus on the question about chest pain. I'm having chest pain. When should I worry? What are the symptoms? So when we talk about chest pain can be from a lot of different things. Sometimes it's cardiac, sometimes it's not. How do you tell? Well, sometimes it's difficult for us as physicians and EMS providers to tell. So it's really good to reach out and seek some assistance. One of the things you have to understand is that the organs inside are not innervated the same way that organs on the outside are. When you touch or smash your thumb, etc., your brain knows exactly what's the problem and where you're hurting. Organs on the inside are not wired like that. They have very vague intervention. So irritation of the heart, of the esophagus, of the stomach, anything internal can really give you some very strange symptoms. So when people are having chest pain, realize number one, that it's not always pain like you would expect, sharp stabbing pain. Sometimes the pain is just a vague uncomfort. It's a feeling of nausea. It's a feeling of shortness of breath. It's a feeling of just something bad is going to happen. So if you're having chest pain that is related back to a heart problem, you have to realize the heart is the main pump of your body. When that isn't functioning right, when it's beating too fast, it's beating irregularly, or just not beating well enough, again, it's a race against time to try to get all of those symptoms, all of those factors corrected.
EMS, what's the address of the emergency?
So what should you expect if you reach out and you dial 911 or call us to come assess you? Number one, we're going to come immediately. We're going to be there quick. We're going to come. We're going to talk to you. We're going to get your symptoms. We're going to get your blood pressure. We're going to get your vital signs. We're going to get your heart rate. We're going to put you on a cardiac monitor. We're going to do a 12-lead EKG to really take a good look at the electrical function of your heart to determine if you've got any kind of risk. So what we're going to do with this information is that we're going to take your other symptoms and we're going to call the hospitals. Now, we work with all the hospitals. We work with the specialty centers. We know where to take you. We know where the best people are to get you taken care of as quick as possible. We're going to alert them. We're going to send them information. We're going to send them your cardiac strips before you ever get there so they're ready for you on arrival. So through this assessment, through the information that we obtain and send to the hospital, we're going to figure out whether you're going directly to the emergency department, whether you're going to the cath lab, whether there's surgery needed, if there's anything else that they need to prepare for. So I want to reemphasize the concept of time. About 1 in 5 people who have chest pain can result in a sudden cardiac arrest. We want to make sure that you call early, that we're there early, and we can get you taken care of and give you the medications and treatments you need as soon as possible. So remember, we're here for you. If you have any kind of chest pain, any discomfort, shortness of breath, feeling dizzy, if you're at all worried or concerned, call us. We're going to respond. We're going to do a great assessment. We're going to communicate with the hospital. We're going to get you taken care of, get you what you need. So if you have a question that you'd like us to answer, just reach out. For the Harris County ESD 11 Mobile Healthcare Service, I'm Dr. Jay Kovar.